歡迎大家。
Welcome to today's press briefing. With us are two doctors, Dr. Chong-Shuk Kwan, Head Communicable Disease Branch, CHP, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. The two doctors will bring us up to date on the COVID situation. Dr. Kwan, please. There are 1,546 COVID patients are hospitalized. 195 are newly admitted patients. For those who are in isolation facilities, 433 are in isolation ward, 85 in second-tier isolation wards, 429 are in the North Lantau Hospital ICC, 149 are newly admitted patients. We reported 4 patients in critical condition, 3 in serious condition. For those hospitalized, 27 critical patients and 21 in serious condition, and 8 are in ICU. We have reported 3 diseased cases, 2 males, 1 female, ranging in age between 87 and 93. For the 3 diseased patients, they haven't been inoculated. For these 3 diseased patients, the first one is a 93-year-old male. He suffered from lung disease and also colon cancer, and also a chronic heart failure. In mid-July, he suffered from shortness of breath and a lot of phlegm, and he was admitted to hospital. He tested positive for COVID, and he was in hospital for treatment. Antiviral was prescribed to him. His conditions did recover, and he was given rehabilitation service. But at the beginning of August, his blood pressure wasn't stable, and there were some variations in the ECG. It was a case of heart condition. His conditions deteriorated and passed away on August 7th. The second one is 87-year-old female. The old lady suffered from hypertension and arrhythmia, and she was suffering from dilated heart valves, and she was admitted to hospital for chest pain, and she was suffering from anemia, and she also tested COVID positive. Her conditions deteriorated because of her heart condition. She suffered from organ failures and passed away yesterday. The last one, 90-year-old male, he suffered from diabetes and hypertension. On August 5th, he was found to be unconscious at home by his family members, and he didn't have any vital signs at the ICU, and he was pronounced dead at the A&E, and he was referred to the coroner's court for further investigation. On August 2nd, he conducted RAT test, and he tested positive, and that was declared. As to whether he's been to other medical institutions for medical attention, we don't have any information. For these cases, I'd like to take this opportunity to let the public know that if you have any elderly family members who test positive, you should make the declaration on the platform, and you should pay particular attention to the symptoms, albeit minor symptoms. Please do not treat it lightly. There are many different channels where we can decide whether we should prescribe the COVID antivirals. We do have the hotline 1-836-115, 1-836-115. We also have designated clinics, and if patients find it necessary at the HA Go app, they can make a booking for telemedicine. And through these channels, we can get in touch with the patients, and if deemed appropriate, they can be prescribed antivirals, because these antivirals can be prescribed at the early stage, at the early onset. This can minimize the problems and minimize the chances of severe disease and fatality. For those who are unvaccinated, they should go get the jab as soon as possible. 173 patients have recovered. 146 have been discharged. 4 patients were picked up upon admission screening, and 9 co-patients and staff members are listed as close contacts. For staff members, 24,664 have been infected, and 26,112 have returned to their posts. At Castle Peak Hospital, the adult psychiatric ward, the female ward, on August 4th, a female nurse was also tested positive for COVID. As a precaution, all the patients in the ward and nurses have been tested. We picked up 2 more patients who tested COVID positive. We announced 1 in the press release yesterday. Altogether, the 3 patients and 1 staff member who tested positive for COVID. The hospital is establishing the link between these patients, and the staff members are being isolated. They're in stable condition, and 10 patients in the ward are listed as close contacts, and they have to be quarantined. This ward has stopped admitting new patients, and this will be thoroughly disinfected. We will monitor the health situation of the staff members and the patient. We will maintain close liaison with the CHP about the latest situation. I hand you over to Dr. Chuang. Well, ladies and gentlemen, yesterday, 3,783 COVID positive cases were reported, 1,439 PCR cases, and 2,344 RAT cases, 262 imported cases, 230 PCR cases, and 32 RAT cases. As Dr. Kwan said, there are 3 deceased patients. At the 5th wave, the total number of fatalities stand at 9,337. Of the 262 imported cases, 140 were picked up at the airport, 94 were picked up at the quarantine hotels, 28 of them were picked up after they've left the hotels. For these 262 cases, they come from 47 different countries. The UK 38, India 35, US 27, Philippines 23, France 15, Singapore 13, and Thailand 12. For the other 40 places, they've imported 10 or less cases. For care homes, there are 3 RCHGs and RCHDs are the reported cases. All of them are reported 1 COVID case. And there are close contacts that have to be quarantined. 中星慈善社劉梅軒 care home for the elderly, 1 resident tested positive, and 3 residents have to be quarantined. 基德南地 elderly home, 1 staff member tested positive, and 1 resident has to be quarantined. Thang Dat care home for the elderly in South K1, 1 resident and 1 staff member tested positive, and 1 resident has to be quarantined. 循道衛理楊振社屯門朗日居 1 resident test positive, and 3 residents have to be quarantined. 彩怡之家 in 荃灣 1 resident came down with COVID, and 9 residents quarantined. Christian Family Service 誠愛兒童之家 and 誠愛兒童之家 3 residents came down with COVID. For schools, today being Tuesday, 280 schools reported 401 cases, affecting 330 students and 71 teaching staff members. They come from 78 KG, CCC 18125 primary, and 75 secondary and 2 special schools. Over the past 7 days, 157 schools have reported 2 or more COVID cases. Today, we advise 8 schools to suspend some of the in-person classes for a week. In Sam Shui Po, the Sing Feng Zai Oi Dak Primary School, Class 3C, 3 students came down with COVID. 6 Yuen Ho Lap Primary School, Wang Tai Xin, 6 students came down with COVID. We proposed that they suspend the class, and there was 1 more student who tested positive.
Zhongzhong Catholic Primary School, 4A class, had 3 students confirmed. Gatewood Kindergarten in Yunnan, 4D class, had 3 students confirmed. International English Kindergarten in Referee Road, Kowloon Tong, lower C PM class, had 2 students confirmed. Shin Kong Koi, Chi Guang, St. George Kindergarten in Kwun Tong, had 2 students confirmed plus 2 teachers. In Taipo, in a class on 5B class on Powu Road, had 3 students confirmed. A special school in Shatin is a P5 class, had 19 students. 2 of them were confirmed. All these classes had to have classes suspended for 1 week. We are also observing the subvariant BA.45 had a preliminary percentage of 12%. So it's now time for answering questions. Please raise your hand and we'll pass you the mic. Before you ask a question, please tell us which media outlet you're from. The first one on the right, second last row, lady in blue. I'm from Now TV. I want to ask about the 3rd death case, the 19-year-old man. After he was diagnosed, he reported his case. Why wasn't he sent to hospital and had to carry out any assessment? That is for elderly people beyond a certain age. Would you follow up on their situation? And if for families with elderly people, what sorts of signs or situations should be a warning sign, and that with that, those elderly people should be sent to hospital? And now with the 3+4 quarantine rule, are you expecting a surge in imported cases? How are you going to prepare for that? Can our system afford any surge in cases? We are expecting an increase in arrivals because there'll be more vacancies in hotels. Proportionally speaking, we would expect a surge in imported cases. And for making the reports on the platform, for families with high-risk individuals, or for high-risk individuals, they should fill in the request to be sent to isolation facilities because they're at a higher risk. As for the death case you mentioned, we don't have too much information about that, the case itself. But as you mentioned, like in a family, if there are elderly people, sometimes elderly people, they may not express clearly whether they're feeling well or not. If they're confirmed to have COVID virus, and often it will affect their breathing or respiratory system. So you need to watch out for even mild symptoms, even just runny nose or slight cough or coarse voice. That could be an early symptoms. So I will call on individuals with mild symptoms to seek medical consultation at an early stage, because elderly people tend to have chronic diseases, and if they have such chronic diseases and together with even the mild symptoms, if they see the doctor at an early stage, that would be helpful. For serious symptoms that require the calling of ambulances, or say shortness of breath, or if someone is unconscious, or if the blood pressure or problem, or if there's instability in blood sugar level, then they should seek medical consultation, and family members can pay more attention to those symptoms. Gentleman at the back on the left. AM 730. I want to ask the medical department, how many tourists have been allowed to leave hotel early today? If you have such figures, then would that actually represent the number of people to be given the yellow code? And also, do you have the number of red codes issued today? And then also like to ask the HA, with the color code being implemented for your staff, have you arranged for any adjustments in the work of your staff? And also, the cases of the 3 patients and a nurse, what are the duties? I mean, those who are these 4 cases that are confirmed. And for the tourists who finished the quarantine and then entering the community, how do you distinguish cases between imported cases and locally transmitted cases? Would that affect your assessment of the transmission in the community? I know that right now, people undergoing quarantine at hotel, they will be arranged to leave the hotel in an orderly manner after they have finished the several days of quarantine and testing. But I don't have the figures you asked for. And as for the red code, I know that from midnight last night onwards, people confirmed will be given the red code, but I don't have the figures yet. So you are saying that for cases, differentiation between cases found in the community and imported cases, you know that for Omicron, its incubation period would not exceed normally 10 days. Our testing right now will take place on the 2nd, 3rd, 6th, 9th day. We will have PCR tests on those days, and the tourists will carry out RAT every day. So if someone within the 10-day period arrived in Hong Kong, and we would look at their records and see whether they are more likely to have been infected overseas or locally. As for our staff, which have a yellow code, our arrangement is that in line with the government announcement yesterday, on the 2nd, 4th, 6th, and 9th day, they will be asked to carry out PCR tests. And every day before they come to work, they also need to carry out RAT tests. If the result is negative, then they can continue to go to work. We also ask our staff to pay attention to the health condition. If their RAT is negative and if they feel unwell, we would not recommend them to come to work, and rather ask them to wait for the PCR test results or seek medical consultation first to see if they have any clinical symptoms which would suggest that they might have been affected. And also for our staff concerned, well, even for those who are diagnosed, they would wear proper protective gear, and we remind our staff to pay attention to wearing proper gear. And how about staff with yellow coat who are having meals? Of course, we will not encourage our staff to have meals together. And all along, in our pantry or in wards, we have arrangements to for separate spaces, and also our staff are also going to have meals at separate times. And for staff with a yellow coat, we would ask them to finish meal quickly and try not to talk to colleagues, and wear the mask properly after finishing a meal, and also observe personal hygiene. And also pay attention to their health condition, be aware when they're feeling unwell. As for Castle Peak Hospital, it is a psychiatric ward, and our nurses sometimes may need to give medicine to patients or even feed the patients. The patients sometimes they may not wear masks properly. So as for the real cause of transmission and how come the cases are linked, we are still looking into the reasons. But now with so many cases, confirmed cases in the community, whether they actually the source of transmission comes from the community. We will not rule out the possibility, but we're carrying out an investigation.
Lady in green outfit at the back, please. Cable news. 93-year-old male deceased patient. It was said that he improved a little bit after being prescribed antiviral. Why did he deteriorate? Was it because of COVID? And also shortening the quarantine period. Now we have received some cases in which he has been quarantined for 3 days. According to the authorities, he can leave, but the hotel said that there was no notification from the DH and he wasn't allowed to leave. So what is the latest arrangement like for these people? Will you issue them with a notification that they have completed their quarantine and allow them to leave? Right. For those who are in the quarantine hotel, this new measure will be implemented on Friday, and for those who have served quarantine for 3 days, I know that the hotels are making arrangements for them to leave in orderly fashion. Right, for the 93-year-old gentleman, he is a chronically ill patient. His heart function wasn't really good enough, and his conditions are stabilized a little bit, and the RAT tests were negative on a number of occasions. Now his conditions deteriorated, and probably clinically it was a case of heart condition. As to whether there are any connections between COVID and this, we will go into this further. I mentioned leaving in an orderly fashion. I don't mean they are leaving altogether today. In the next couple of days, they will be leaving in an orderly way. A lady in white jacket. Dot news. Each day, the caseload is lingering around 4,000. Why is it that there is no trend of any decrease? There are many people who said that there are many people around them who test positive, and there are many chains of transmission, and people do not declare the infection. Will the department take the initiative to investigate into this, and will you be enforcing the law in this regard? Well, in the community, there are many chains of transmission, and Omicron is highly transmissible, and I hope that the members of the public who have been to high-risk places, and if they know that there are people around them who got infected, they should go get tested. And if they feel unwell, they should go get tested. If they test RAT positive, they should report as soon as possible. And if they can be prescribed a medication, in the first instance, they can avoid severity and also mortality. For those who haven't been vaccinated, they should go get the jab. Lady over there, please. Ming Pao Daily. About the deceased cases, now there are 3 deceased patients that haven't been vaccinated. So can you be more specific about the vaccination record? The 87-year-old old lady, she was admitted to hospital for chest pain. What day was she admitted, and when was she tested COVID positive? Was it a case of in-hospital infection? And the old gentleman, 98-year-old, is there any further information about him? And are there more cases of people who tested positive who passed away at home? Will the HA or 6P get in touch with the elderly people who tested positive at home? And also quarantine hotel, Dr. Chuang, you mentioned a moment ago that for those who have stayed in quarantine hotel for 3 days, they will be leaving the hotels in an orderly manner. And who will be allowed to leave first? Any criteria there? Now for the BA.2.12.1, what is the percentage today? where it's not the case that everybody will be leaving all in one go because of the sheer number of people, and the hotels will be making arrangement for people to leave. Even if they have served out the quarantine, they have to be tested and before they will be leaving. I don't have all the details with me though. Next question, BA.2.12.1 is 6% or more. About the 3 deceased cases, other than the last one, 90-year-old male, he had 2 shots of vaccine. The other 2 never had any vaccination. 87-year-old old lady, in early July, she suffered from chest pain, and upon admission to the hospital, it was probably caused by anemia. And in mid-July, she was hospitalized, and she tested positive. The CT value was 30 odd, and we monitored the situation. The CT value dropped progressively. We do not rule out the possibility that she was infected in hospital. As to her conditions, she came down with COVID. We prescribed the antiviral to her, but her conditions, her heart conditions, became serious, and her condition worsened, and she passed away yesterday. You asked how we can get in touch with these kind of patients. Now, we would, through our colleagues, get in touch with the high-risk patients, and the patients that are coming to the HA hospitals for follow-up consultation. We will get in touch with them. We ring them up to check whether they are unwell. And for those above the age of 60, whether they have been inoculated or not, we can prescribe them with the antivirals. This is something that has been going on. We may not be able to cover every single one because some of the elderly people have been in isolation, and some of them may be in hospital. We may not be able to get in touch with all of them, but we will try all means to get in touch with those that we are concerned that they may not be able to get in touch with us. So we are trying all means to get in touch with them. Let's begin the last question, the last but one row. The gentleman over there, please. HK01, the 20-month-year-old baby suffering from croup, and also the yellow coat kitchen workers. Are there any dangers there? And HK will have the telemedication service. Will you be broadening the scope of this? The 20-month-old baby girl, her condition has stabilized, and she has left the ICU. We are monitoring her conditions. You mentioned telemedicine consultation. It is our intention to broaden the scope. We are fine-tuning the service for those who are in need. We hope that we will be broadening the scope to cover them. With the launch of this scheme, it has gone down particularly well among the general public. So we will try to make it convenient for the members of the public. And we will try to make arrangement for the teleconsultation as soon as possible. For the red and yellow codes, I know that the FHD has really made the announcement. That's it for today. Thank you all very much.